Hi, everybody. I'm back. I just wanted to go over some of the things that I wish I might have known more of before I decided to have surgery. It wouldn't have changed my mind. I want to make that clear up front. I still would have gone on with the surgery. I just might have been able to better prepare myself post op. Uh, so, the few of my coworkers who had it done at work, one had bypass, one had the sleeve. Neither one of them complained about pain. And for me, I had horrible, horrible pain. So much so that I woke up in recovery and looked at my husband and said, "Oh my God, what have I done to myself?" Being the sweet man that he is, he said, "You're making yourself healthy." Yeah, that was sweet of him to say, but I'm going to be honest, I really didn't care. All I knew is I was hurting and it was the worst pain I've ever felt. And I've had 5 kids, no pain medicine. So, yeah, obviously everybody's different, and I have a very high pain tolerance. I don't know if it's because when the doctor moved my liver out of the way, which he said was normal, thin, floppy, exactly how it's supposed to be, that it got irritated. It didn't like being messed with, so it swelled up like a big balloon, he said. And they had to stop, and I think he said it took about 30 minutes for the swelling to go back down for them to be able to proceed. Um, but I don't know if it's just because that irritated things more or what. I really don't know. Or it could just be that maybe the nerve block they did on my stomach, they did it in 3 areas. Maybe it just didn't take like it should have. Because everybody else I know really didn't complain about a whole lot of pain. They complained about gas pain. I didn't really have much gas pain. Um, so I wish I'd have known what the true pain was going to be like. Um, the other thing I wish I'd known is how hard it was going to be to drink. To get in 64 ounces of fluids a day. And I don't mean tea, coffee. I mean, your water, your flavored water, your protein drinks, etc. For me, yeah, no, it probably took me a week to get 40 to 50 in, if that. And I had to have a protein drink in order to get that in. Um, so that probably for the first week and a half was the hardest for me, was getting in 50 to 60 ounces of water. Now I'm getting in my fluids, no problem. I make sure I get in the first half by noon, and then I have all evening to get in the second half. So I normally end up with more than the 60, 64 ounces, which is great. But I really wish I'd known how hard it was going to be. You think drinking, I drink all day long. You don't realize how hard that's really going to be. And it was. Tastes. Everything tasted sweeter. You hear it, but you really don't believe it. Um, Now I haven't found. I mean, I'm only on soft foods because I am 3 weeks post op, but I haven't found that anything truly like tastes like I dislike it. That I've had so far. Some things just taste sweeter. Other than that, I haven't really noticed anything else. 4, I wish somebody would have told me that when I woke up, I was going to literally have no spit. My mouth for the first 2 weeks was so dry, it was ridiculous. I mean, I mouthwashed, brushed. I mean, I did, sucked on popsicles, everything, drank, and my mouth was still bone dry. I still don't have a ton of saliva at 3 weeks post op, but um, it is getting better. I know, I understand. I expected to wake up, sore throat, blah, 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 all that from having the tube down you when you're asleep to help you breathe. Um, but my throat didn't really hurt much. I had a scratchy voice for about a week, but it never really hurt. Um, So, coughing. You know, I'm a nurse on a med surg floor, and we always tell our patients, hold that pillow when you cough. It'll help you feel better. You know, I never experienced that myself. Having experienced it now, yes, any patient who doesn't want to hold that pillow, I'm going to tell you, if you go and you have the surgery and you have to cough the first week or so, hold that pillow, blanket something tight on your stomach, and cough. Get that crap up. And it's gonna hurt. I'm not gonna lie. I'm not gonna say, oh yeah, it's gonna make it not hurt at all. No, that would be a lie. It's still going to hurt, but it's going to help you be able to tolerate it. Um, I've had no problem with bowel movements. I know some people do afterwards. I've had no problem. So I'm thankful in that area. The hardest thing I'm finding is getting in protein. Before surgery, I could tolerate the protein shakes just fine. Now they go straight through me and upset my stomach. I don't know why. I mean, they taste fine to me still. My taste for them, I mean, they taste a little sweet, but my taste for them didn't change, but how my stomach handles them does. You know, you go in and you know they're going to make your stomach smaller. Sleeve, they make it about the size of a small banana. That's the best way to describe it. So, oh yeah, I'm only going to be able to eat a little. But you don't realize how little you are truly only going to be able to eat when you come out of surgery. I am 3 weeks and I can put maybe 2 ounces of food in my stomach. 3 ounces if it's soup. Another thing is I have no desire to eat. I eat because I am diabetic. I am on no diabetic medicines right now. But if I do not eat and get protein in, my blood sugars plummet to an unsafe level where they don't need to be. So eating is, eating, you chew, you swallow, blah, blah, blah. But I only get about 2 to 3 ounces in. Generally, 2 ounces. I've had a couple times where I thought, well, is this what it's going to feel like now to get full? And I take another bite and I would be in excruciating pain. And the pain would be all up in my chest. So, yeah, feeling full after the sleeve is different than feeling full when you just shove your mouth full of food and you eat and eat and eat and eat. So that's a totally different experience. Getting used to taking all these vitamins. I'm on 2 Flintstone complete vitamins a day, iron 3 times a day, and then calcium 3 times a day. I had my blood work done at my 3-week post-op, and so far so good on my levels. Hopefully they will continue to stay that way. I know I'm only 3 weeks. Hasn't really been much time for my body to deplete out of much. Other than that, I'm doing well. My incisions are healing nicely. Let me see. I still do have a funky one. My doctor said it should have popped out to normal by now. He said it can be. I can have a reconstructive and blah, 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 whatever. I plan on having skin removal surgery later with muscle repair. So it can be taken care of then. I'm not going to worry about it at this time period. Let me see. That is my funky incision. And then got this one, the scab has come off. That one, the scab's about come off. I don't know, I only have 6. And that's all I got for my incisions. Sorry, it's my finger. But they were just glued. They said don't scrub them, just let the glue come off on its own. The blues mainly come off on most of them, and the scabs. They're pretty thick scabs. They'll come off when they come off. I will say this. Expect to be extremely fatigued. I am so fatigued. It's way better now at 3 weeks than it was at 1 week. But I knew I'd be tired. I didn't realize how tired. Nobody ever expressed to me exactly how freaking tired your body is. So, other than that, that's just a few things I wish I'd known. I guess I'll figure out more as I go through this journey. If y'all could hit like below and hit subscribe and follow this journey with me, that'd be great. I'm a 40-year-old mom of 5, been married over 20 years. I'm a nurse. So being fat doesn't have to just do with sitting on your butt doing nothing. It happens to the best of us. So if you just join me on my journey, and my journey is going to include many things. Fortunately, my 10-year-old and 15-year-old daughter know way more about makeup than me. I'm going to work on learning how to put makeup on and wear it right, and all that fun stuff. And it'll definitely be a journey as I lose this weight with clothing and everything. And my heaviest weight that I know of was 316. November 2016. Surgical weight was 296. I'm currently 271. Biggest size was a 28. Pre-surgery 24, 22, 24. I think it just depends on where it's from. I'm currently fitting into some 20s and some 2X shirts. I was 3 or 4X before, mainly 3s. So things are going well so far. No major complications. Fingers crossed it stays that way. But yeah, so this is going to be quite an interesting journey, and the journey will end with me hopefully getting some skin removal surgery with muscle repair this time next year. So just subscribe, follow, like, all that good stuff. Bye.